Hi, my name is Dr. Corey Skubish with TECM Health. Today I'm going to review the EXSTORE system. The EXSTORE system is motor point stimulation neuromuscular treatments created by Anthony Lombardi out of Canada. The EXSTORE system is like it says, it's a system. So it's testing, trying to find motor inhibition using different treatments to help turn on those inhibitions. When we have muscle inhibitions, we compensate. The compensation is what causes some pain, muscles you just feel off. So I'm going to walk through with the patient, show you what I do on the first visit. This is just an example of the first visit, and then subsequent videos I'll be kind of walking through different special treatments. So we're going to come over here and I'm going to do some testing and go through there, okay? Hi, how are you?
Hi.
I'm going to tell you, we're going to do some muscle testing. I'm going to tell you what to do. If it hurts while I'm doing it, you just let me know. If it doesn't, you don't have to tell me anything, okay? Perfect. We're going to bring this arm up. You push up, I push down. Good. Push up, I'll push down. Beautiful. Push backwards. Beautiful. Tuck your arm to your side. Push in against my hand. Beautiful. Push out. Good. Extend your arm, push up. Good. Thumb down, push up. Beautiful. I'm going to bring this arm up, push up. And there you go. So we have a muscle out. I'm going to show you that muscle. It's the serratus anterior. If I push here to activate it, just kind of activating, push up, please. Boom. Just a little touch there, push up. And it just activates that muscle. So when that muscle's out, we have compensatory other muscles that have to work harder to operate the shoulder, and those are going to be your upper trap, your levator scapula, and rhomboid. So this whole area just to operate that shoulder. So in a few minutes I'm going to do some treatment and it'll all be turned on. And I'm going to test this side. You push up, I push down, good. Push up, good, and backwards, good. And tuck to your shoulder. So the muscles push in, good. And out, good. That I'm testing, push up, are what we call the rotator cuff muscles of the shoulder. Push up, and there we go again. It's okay. Go ahead and lay on your back for me. And the reason why we do that, and why I'm going to test the hip here as well, is because the hip, shoulders, those muscles tie right into the spine, and then it affects the whole chain. Bend your knee and just relax. Beautiful. And what I'm trying to do with this video is just show you straight, and she's in hit. I should be able to go right here pretty easy, and it's locked right here. So after the treatment, hopefully you'll release, push up, good. Extend your leg. I'm gonna put my hand here, push this leg up, and there it goes. It's okay, it's all right. So, I apologize. So I'm trying to shoot this video to show you the EXSTORE system, how fast it goes. So the idea of this is to kind of get you some relief pretty quick by fixing these inhibitions. Push up for me, good, and straight. Push up for me. And really, the treatment can be a lot of different things. Motor point stimulation, push, there you go, good. And push out again, push out, good. Push out, beautiful, and push out, good. Push both legs together for me. Beautiful. And she's really struggling there. But the treatments, and you'll see what I'm doing, is I could do soft tissue work, dry needling, electroacupuncture, motor point stimulation. It's pretty amazing the different kinds of therapies we can do. So if a little needle scares you, we could kind of figure that out as well. But it's really the testing, the why am I doing that? So what I want you to do, Jessica, you're going to up, down, up, and do that over and over for me. And without thinking about it too much, is one side harder than the other to do?
This side feels easier.
Easier? So bear down on your stomach. Okay. Make your stomach tight for me, and now do it. Does it stay the same or a little easier?
This side's easier now.
Good. So that, just that little test tells me it could be her oblique, right? So her right oblique is kind of a little inhibited, making it harder to lift that leg up for me. Can you do me a favor, lay on this side for me, please?
Yes.
And then you lift up, push up, I'll push down. There you go, relax, flip over on this side. And what's amazing, you're gonna see here, unedited, I'm gonna do some treatment and I'm not gonna be able to move this at all. Lift up, push up, and there you go. Lay on your belly for me, please. So the EXSTORE system, it's amazing. It is, why I keep saying that is because I love it. Lift your leg up as high as you can, good, and then push up. I am not doing acupuncture. I'm not doing meridians. Lift your leg up for me, good, and relax, push up. Beautiful, go ahead and lay on your back for me. I love acupuncture, I think it's amazing, but this is not acupuncture. I am using a needle, the acupuncture needle, but I'm using muscles and nerves, mainly the nerves out of those muscles, to break up what we call neurogenic inflammation. So I just want to kind of give our bodies some relief. And relief from what? I mean, if I say something's inhibited, it doesn't mean there's anything wrong, anything's broke, just wear and tear. Could be from sitting at a desk too much. It could be driving in a car. You're playing baseball, volleyball, whatever. There's so many, excuse me, any reasons. Can you please lift your shirt up just to your belly button? So what I'm about to do is something that I learned at one of our sessions, and it's changed the game for me. You're good right there. Are you comfortable with this? Okay.
Yes,
Here. So what I'm going to do is, this is now education for anybody that's acupuncturist or whatever. I'm going to use the transverse abdominis and internal oblique to use the nerves that are coming out of the lumbar plexus that is going to neuromodulate and break that up. The whole chain on both sides, for whatever reason, is just not, it's just blocking. So I'm going to unblock that. So just a little touch here. If you feel uncomfortable at any time, you just let me know. A little poke. Good, there you go. Can't see it on camera over there. It's okay, a little muscle, bink, and it goes like that. So it's pretty cool. So there you go. Again, a little poke, beautiful. Hook this up with my E-stim. What I like about EXSTORE, or the motor points, or what we did with what they found when Dr. Lombardi created this, it is in the same spot on me, on Jessica here, on a little 15-year-old girl. I mean, it doesn't matter. It's in the same spot, so it's very easy to find. You're going to feel this moving right here. There you go. And so you're going to come around and show. And we're just going to do this for a couple minutes. I'm going to do some soft tissue, and you're going to see all of these muscles turned on within these 10 minutes, 15 minutes of the appointment. Now, I could take much longer, we could go slower. Everything depends on the patient and their comfort level. Some people just need a little more time. There's just a fear of needles. So I'm here to just make it easy, a safe environment, comfortable. But if we don't fix the inhibited muscles, a little stim on this side. There we go, we got both sides going. But if you are, hey, I have to go see a physical therapist, I have to do that. If your muscles are inhibited, those exercises, you're not going to get much out of those exercises because the muscles aren't functioning properly. So you're going to do them, you're going to walk through that motion, you'll feel good for a minute, or maybe you'll feel worse because you're still compensating to do those exercises. So this is why I love EXSTORE. When you come see me for EXSTORE, I do examination. Any muscle that I find that's inhibited, I guarantee I'm going to turn it on, barring any neurogenic disease or issue or things like that. But if I find a muscle or a series of muscles that are inhibited, or I find that why, I will turn them on. And then you'll walk out and everything will be gone. Now, pain is different. If somebody comes to me and they have pain, it's the why do we have pain? Chronic, acute. Everybody has a different range of how they can deal with pain, but it takes a little time. But again, I'm kind of running off on a tangent because I'm trying to fill in space, but we're almost done here with just how fast this works. But yeah, so that's pretty cool stuff. And she's doing a great job. So what I would do with Jessica here is, now she's just coming for wellness, just to check up, make sure everything is good to go before she starts teaching yoga and doing her thing, which we're all excited for. But she just gives her a nice little reset, maybe seeing every couple weeks. Now, if she came to me and had a serious, hey, I fell snowboarding a week or two ago, or I've had this chronic pain for X amount of months, it may take a couple times or do a couple times a week. It just depends. Every patient's different. I don't have a set protocol. This is what I do for every patient. Every patient comes in, I treat them as an individual, and we build a plan together. It's really working together to find what will work for that patient. Now, this has not been edited. I promise. I know I keep saying that. I don't know how to edit anything, so we're just kind of going with this. But that was it. So a couple minutes of doing that, and just relax your leg for me. Every patient that comes in, I do EXSTORE. We always do soft tissue. Always. You have to get some soft tissue work in there, just movement. When I say soft tissue, I'm not saying massage. I'm just working to release this area. That's pretty cool. It feels really good. And it shouldn't hurt. I don't think that hurt much, right? It's not uncomfortable. I mean, there's a little needle poke. I can't make that go away, but I try to do it quick. But it's pretty straightforward. And here in a moment, I'm going to do some testing and just kind of show. Hopefully, if I did it right and I freed stuff up, her legs will get some range of motion in there pretty good. Just relax your leg, let it relax, and then boom, it goes up. But we got a little work to do. I could get a little better, but we were here before. So go ahead and push up for me, and like a rock. I cannot move that, which is good. And relax. Push up for me. Beautiful, nice and good. Now do me a favor, lift those legs again for me, and let me know, does that right feel better? It does, good.
Actually,
And
feels better than the left now.
all right. But it's good.
Way higher.
Good. That's awesome. And then go ahead and lay on this side for me, please. But go ahead and relax. So every patient, relax your arm, just bend, that comes in to see me, the first visit, you have a shoulder issue, your back hurts, foot hurts, head hurts. I'm always doing a systematic functional improvement. I'm always doing that first. A lot of times I'm not even addressing directly the issue. I mean, I'm indirectly doing it, right? So, I mean, I'm not going to just stick needles in your shoulder if your shoulder hurts. I need to get the whole system functionally working. Then I have you come back, flip on this side for me, say a week later, a couple days later, just depending, see how that week went. Get back just living your life. Was it good, better, is it the same? And then test you again. If everything is still turned on, everything worked after what we just did, and you're still having some pain in the shoulder or the foot or headaches, then I dive into that, right? We do some work directly for that. But if I only do your shoulder, as an example, you might feel good for a couple of days, but the whole chain is still out. So what was the point of that? Go ahead and sit up for me. Again, that's why I love the EXSTORE system. So we're going to test. Bring your arm up, push up. I cannot move her. And it's pretty awesome. And what's cool is push up. It's pretty, and I'm really trying. So if that shoulder was still weak, I would work on that. You're not leaving until I get everything turned on. So thank you for listening. I just wanted to shoot a quick little video, how fast that is. I absolutely don't know how long this was, but this is what an initial EXSTORE visit would look like. If you have any questions, please give us a call at TECM Health, 480-718-1238. Really appreciate your time. Look forward to talking to you.